Now, giving Rupert his insulin. The insulin will be in the fridge here. There will be a whole lot made up for the week just sitting in the fridge in a plastic container. I will also have some other insulin syringes in a slightly higher dose and lower dose in the small bar fridge down in the family room. I'll show you where that is. That's only an emergency if we need to change his dose. Now that's coming down the family room down here. So I will have some other doses if we need to change his doses. There's just sitting in this fridge in here. But I don't expect we'll need to do anything in that area. Hopefully not. Okay, so the standard doses that will be here will be all made up ready in here. So you just take one of these out, yeah, like so. Now, these won't be showing the exact dose as measured because what I've done is I've pulled a little bit of air up into the syringe as well so you can agitate the insulin before you give it. So before you take the top off, just agitate it like that. Give this a couple of flicks just so that will mix the insulin again because it will have been sitting obviously in the syringe for a number of days. Okay, so when you've done that, then get Rupert. Whatever's easiest, you can put him on the stairs again, on a bench, on a chair, however you find easiest to give him his injections. He is very good. The most important thing when you're doing it, I will have some areas clipped up of hair, and just carefully pull the top off because, there we go. Make sure you don't hold the bottom here when you're pulling it off because you could accidentally squeeze some out. But the main thing is to make sure that you are pulling the scruff right up so that there's no risk that you could put the injection too far in to hit a muscle layer because otherwise that will absorb too quickly. So you just pull the scruff right up. You can see there's hair shaved there, so you can see that there, and then pull it up and inject it like so, and then push the button down the top of the syringe. And then pull it out and give it a good rub like that just to make sure that it gets absorbed properly. As I think I've mentioned to you, he does have quite a few scabs over his skin because he just does react to the injection a little bit. And then he's done. So his routine, as I said, is as soon as you get in, feed him straight away because once he's been fed, he'll be a lot easier to do. As soon as he's finished his food, come down and take his blood sample to do the blood sugar and then obviously look at the reading. And as I've mentioned, as long as it's 5 or above, it will be just fine to give him his insulin dose as I've got in the fridge. I'm expecting it'll probably be somewhere between 5 and 11, which is where we want it to be. If it's a lot higher than that, then that could mean that you've just missed, by some reason, his dose previously, I'd expect, or maybe the dose is a little bit low, but it should be fine. And if it's lower than that, if it's sitting on 3 or 4 before he has his insulin, that may mean that we have to actually drop his dose, and that's when you do need to contact me. But all going well, he should be fine.